No problem. Happy to be here.
Great. And is Wilma here yet? I don't know which is her phone number.
She's here.
Great.
Wilma, *6 to unmute.
Hi, this is Wilma.
Hi, Wilma.
Did you start yet?
No, we're going to start in a few minutes. Bonnie's not here, but we could always start with Aileen.
Okay, Aileen. Okay, what is Bonnie's? How do you pronounce Bonnie's last name? Barbara.
Well, Aileen, is it done?
No, no. How do you?
What? Bonnie's last name?
Yeah.
Sounds like Lou Ma. What? Does anybody know? Aileen, do you know, or do you know?
Lamagi?
Something like that. Yeah.
Okay.
Okay.
Bonnie Lamagi.
Just 7 minutes.
Can you kick me? Oh boy.
Very good.
Yeah, I think it's Lou Magi.
I've heard her speak, but I'm so bad with
Lamagi, right?
Right. Will, would you interrupt or Rebecca if you see Bonnie coming?
Hi, Rebecca.
Hi.
Aileen, we're all a little exhausted. We had a meeting that started at 6:30 and ended, what, Will, at 10 after 11 or something like that?
No,
Yeah.
10:57.
10:58, yeah.
Oh, I lied to people. I said it was after 11.
Wow.
Way after 11.
Oh, and then I don't sleep well after that. It's just like, you can't go right to sleep.
Yeah, no.
So we'll do that. So I think we could get started anytime Will wants, or we want, and then we'll do.
Are we streaming?
You are, yeah.
Oh,
Okay.
I'm sorry.
No, all good.
You didn't.
It just happened. I just finished everything.
Okay.
So whenever you're ready.
I'm going to get started, and then we'll take over. And Rebecca, I want to thank everybody that's here for coming. We're holding this meeting at 4, which is not our usual time because the May calendar was so filled up. And I know I've been on Zooms with the borough president. It's been such a pressing topic of opening the senior centers that we thought we should hear the reasons why we should open it up and why it's so important, with the idea that we can make some difference, possibly a resolution. So Wilma, do you want to introduce everybody?
Well,
let me just say that I'm Barbara Rutter. I forgot to say my co-chairs are Wilma Johnson and Rebecca Dangor. So we're so pleased to see everybody here. Thank you.
Hi, this is Wilma Johnson, and thank you for coming. This is a line. This song Seka. I hope I got that right.
Aileen.
She's with the departments. She's an aging service coordinator, and she's presented to us because Alan Rooney, cannot be here. Alan Rooney is the director of aging services at Family Hydrants. So we appreciate you coming, and we'll look forward to see what you have to say. All right. Thank you.
Thank you, Aileen. Do you want to, if you would talk to us about the status of.
Sure. So thank you for having me. My name is Alini. I am the Aging Services Coordinator for the Taft Senior Center with Stanley Isaacs. So I'm a little more focused on the East Harlem part of our programs, but we've had similar situations, similar obstacles that we've been facing over the last year. And thinking about as we start to consider reopening. So, for the last year, we've done a lot of work to pivot to do as much as we possibly can, first of all, virtually, to keep our seniors engaged and not feeling isolated. So that's looked like a number of different things, including having more engagement, virtual programming, calls with our health coach, case managers, nurse, trying as best we can to stay connected to our senior population. And we've also been addressing head-on issues of food insecurity, mental health, that's really popped up because, isolation, also a lot of issues around chronic diseases, access to healthcare, fear, all the things that come along with dealing with an aging population. And really trying to be creative as much as we can to address the needs of seniors from a distance for the most part. And we're still pretty much virtual at this point. We've had some outdoor events, one-time events at 93rd Street, at Taft. We haven't had any of those just because we don't have the space. So, as the conversation pivots to reopening, we're really looking at what can be done to reopen safely, and what we need to reopen safely. There's conversation coming up about meals, grab and go meals specifically, potentially in the future, actual eating inside the center, as well as the potential for the center to be a cooling center over the coming months in the summer. And we're looking at that. And then we're also at the same time addressing the need of seniors to have AC simultaneously, depending on what kind of access they'll actually have to be in the center. But I think that the conversation also includes that we need a little bit more guidance. I don't know if Greg wants to step in and elaborate on that a little bit more, but I think we're looking for more guidance, a little bit more of a clear plan, again, to ensure the safety of the community as well as the staff who will be in place as we reopen and have, more people in the center, thinking about social distancing, testing, all of those things.
Yeah, this is Greg from the Isaac Center. If I could just jump on for...
Yes, Greg, I didn't know you were here. Thank you.
Hi.
Right.
Yeah, I thought I'd jump on as well just to fill in the gang. So Alini, thank you for that opening piece about the Isaac Center. And thank you to the committee for allowing Isaac Center the opportunity to weigh in. As you know, we have a footprint at 93rd and 1st, and we also have a footprint up in East Harlem. Obviously, as Alini pointed out, we've been working very hard to address older adult services throughout the pandemic. Home delivered meals was not disrupted at any point during the pandemic. We've only increased food access to older adults in need. In terms of the senior center, it switched to a virtual model at both 93rd and East Harlem, as Alini pointed out. And we've invested in healthcare services, access technology, making sure older adults have ACs as well has been a big part of our portfolio. But as we talk about opening, just to kind of add to what Alini shared, we have heard it has been communicated that there is a desire to see older adult centers open in July, at the beginning of July. July 1 is sort of the placeholder. We have not gotten any direction or clarity at this point from the Department for the Aging or from any administration about what standards, qualifications, expectations are expected to be able to operate on July 1. Nor are we clear what additional resources will be available to us if we are able to open on July 1 and what capacity will look like on July 1. We have been working in close collaboration with a membership organization, Live On New York, as well as other providers in and around New York City to communicate to the city largely what we think at this point might be needed to ensure the safety and welfare of older adults and our staff as we seek to open our doors once again. And that includes ensuring proper ventilation, that includes assuring access to PPE, that ensures as well capacity issues in and around our buildings so that we're not overwhelming any of our spaces, I will make a couple of notes for you. At this point, the Department for the Aging, as well as the city, is interested in getting a sense from us as to how many of our staff members have been vaccinated, because they, and the desire to be able to say in neighborhoods or communities where they're, the personnel or the communities where we are working, where maybe vaccination rates are not as high as they could be. And we know disproportionately in this city, a lot of communities, in particular Black and brown communities, were not accessing or not able to access the services as other communities because the city had not rallied, at least initially or throughout the pandemic, to serve those communities well. That the city may be looking to see a certain number of vaccinations amongst your staff before they start allowing folks to open the doors. There's no clarity about that. There's just the indication that the city is interested in hearing about vaccinations of personnel, not of members, but of personnel, to get a sense of what the sort of rate of vaccinations are amongst our personnel. There's some challenges with that I just want to note, because that information is confidential. That is HIPAA. So we have HIPAA guidance about that information that needs to be kept private. So they can only do that anonymously or ask for that information anonymously. So again, as a provider right now, what we are advocating for is an opportunity to work with public health officials, opportunity to work with DFTA, opportunity to work with City Hall and our electeds to ensure that our spaces are safe for reopening. Mass access to vaccinations is critical. PPE expectations and ventilation standards are all in place so that when we officially open our doors, we are capable of saying that we are following the best guidance and standards of keeping our community safe. As everybody here knows, older adults were hit particularly hard by COVID. Our residents, our community members in East Harlem and Yorkville, our older adult members were hit particularly hard by COVID. I am grateful for all the wonderful stories that there were about folks who were ill at one point, but were able to find recovery. But we also experienced a great deal of loss in both of our communities. And we don't want to see that happen again. So all this to say, I wish I had more, and I know Alini does too, I wish we had more clarity at this point, but the door is just sort of beginning to open about what is expected of us and what it is we're going to hold the city accountable to be able to open our doors.
Rick, I'm going to step in.
And I just wanted to step in really quickly. Barbara, if that's okay, make a short point. There's just also something we need to consider when discussing this topic about why it's so important. And
this
that's
was
the
just what I was
digital
about
divide.
to say. Yeah, Rebecca,
the
this is what I was about to say.
I can't finish.
I was on the Zoom with you and Bonnie and some others with the borough presidents when she had the Zoom, and a lot of it is why it's desperately necessary to open up. And yes, it's a two-part thing. You don't want to open up and get people sick. So what you talked about is what you need to ensure that sickness. Would either you or Aline, how do you pronounce? I'm sorry, I thought it was it's Aline. Is your name?
Alini.
Alini, thank you. I wasn't trying to pronounce it. Would you either talk about the positives, why it's so necessary? For instance, meals. It's very nice that they're getting food, but part of the meals that was around was a socialization that's not there. I mean, what is the negative about not having the senior centers open? And what is there was a lot of talk about the discrepancies, having restaurants open and museums open and so on, and why not museums? Would you mind talking about that too, the positive side of it?
Yeah. And just
I can
quickly,
talk about it also.
Just quickly, so I could finish my thought. When I talk about the digital divide in this specific case, it's not just about lack of devices or lack of affordable connection. It's also that we have to understand that there is a technological savviness divide, especially amongst our older residents who need physical contact or who would benefit the most from Zoom, et cetera, as well. And I know that a lot of services are being provided, but that remains a limitation. And this would be an important step in ensuring that, our seniors.
I think there was talk that Zoom somehow doesn't take the place after 14 months of not seeing anybody.
I would like to talk about that because I'm one of the seniors that is suffering because of this. not having a companionship with all of my friends. I had a lot of friendly relationships with seniors, and some of them I have not even seen for almost a year. When I do see them, it's like a joy. It's like so exciting to see somebody I've not seen them for a whole year. It also, being in the house all the time, you become very, very depressed. You don't know where to turn, and although you can make a call to your worker, it's not the same. It's not the same as seeing somebody and shaking a hand or taking a hug or just seeing the person is still alive. I mean, I haven't seen many people, but when they see me, they're just as excited as I am to see them. It's so important for us to get out of these houses. It's like a seniors are forgotten people. Everything is opening up, everything. You can eat in a restaurant, you can go to a museum, but seniors are still stuck in the house. And I think it's very sad that we are not getting out to our centers. I really miss the center. I really do. I was there every single day. So now that I'm not there, I'm telling you, it's extremely depressing. I've been very low key. My whole morale, my whole sense of going ahead is it hurts my heart to be in the house all the time. So I really hope that this gets resolved even before July. Even if we had little, put a tent up outside and just get a chance to just talk. And that would be good. So that is my plea to everybody that's a director or coordinator to try to see how we can do this. All right, that's enough for me now.
And I think Bonnie is here too. Am I right? Will?
Yes.
Thank you. Hi, everyone. I'm Bonnie Lumagi. I'm from Hamilton Madison House, and I'm the Assistant Executive Director of Older Adults and Community Services. And many people have already said a lot of the same feelings that we too have at Hamilton Madison House. Rebecca, we want you back in the worst way too. We miss seeing everybody.
That's Wilma, by the way. That was Wilma talking.
Oh, sorry, Wilma.
Yeah.
It showed Rebecca. I apologize.
Yeah.
Wilma, we want you back, and we want our seniors back. We miss them. We know how important programming and activities are for our individuals. And I agree with what Barbara was saying and others were saying. Zoom, while a great option when you have nothing else, it is not the same as in person. It is not the same. And after so many months, we need to get back, and we want to get back. And we want to do that in collaboration. A lot of what Gregory said and a lot of what Alini said is very accurate, and we feel the same way. We need to do this in collaboration with DFTA and the guidance from DFTA that is coming in, but it is trickling in. For example, we've gotten 3 memos now about how to go about doing grab and go. And you need to have a bunch of things happen first before you can even think about opening your doors. Our centers have been shut down for almost a year. They have to be deep cleaned. They have to be approved. We have to make sure all our permits are in place. This is a process. This doesn't happen overnight. And what worries me is that sometimes our funders may think you just flip the switch and we all go back to work. That's not accurate. And our centers were not set up for socially distanced. And now I'm just hearing, well, maybe you don't. There's a lot of, the CDC is changing their mind every day. They just literally announced today, maybe you don't, if you're vaccinated, you don't need to wear a mask inside, except maybe if you're on the train. So it's very confusing. And vaccinations, and can you ask a staff member if they've been vaccinated? That's a tough one. You can ask, but if they don't want to answer, they have the right not to answer you. It is their private medical information. And so there's a lot of gray in this area. Most of our staff is very willing to share that they've been vaccinated, but not everybody is. So there's complications, but there is a desire and a need. And I think for that desire to happen and to happen as quickly and as expeditiously as possible is advocacy. You all need to, together, what Wilma was saying was so beautiful. Your council people, the mayor, everyone needs to hear that. And I think the mayor is starting to hear that. And that's starting.
Honey, I heard him this morning.
It's not perfect. And
Well,
I think
it's very important, except we have to make sure everybody is safe. That's what he said.
No, I understand that. And he's not wrong. And of course he's going to say that, because I think what it comes down to in some ways is nobody wants anybody getting sick or dying on their watch. And COVID really hit older adults hard. And a lot of, and something that we're not talking enough about is when our centers reopen and Mr. John isn't there anymore, and Mr. Smith isn't there anymore, and Mrs. Smith isn't there anymore, the trauma that we're going to have to deal with when the seniors come back and many of their friends aren't there anymore because so many people passed away from this and no one's talking about that. So I think that is another piece of this that has to be thought about. And there's a lot of pieces to the puzzle. We're not going to fix it all in one day, but I think that if you want anything to get done, because they were able to open schools, and they were able to open schools because of pushing. And I think that's what needs to happen. And I know that your borough president is pushing, many of the council members are pushing to restore the senior centers.
Right.
But
and just quickly before we move on, I did see we had a hand raised, but from a member of the public, but it was lowered. And I'd just like to remind you, if you have a question or a comment, please use the reactions button to raise your hand and we'll call on you. I see. Paki, I apologize for mispronouncing your name.
Hi.
Please introduce yourself.
Yeah, absolutely. Thank you. I'm Paki Kane. I'm the Deputy Executive Director at the Isaac Center. I have the privilege and pleasure of working with Alini and also Greg, and just wanted to say thank you to the committees for convening this important conversation. I did want to just comment on something that Bonnie said, and Bonnie, thank you so much for your comments. We're obviously experiencing a lot of the same of what you're saying. I just wanted to recognize that Isabella Brew from the Borough President's Office is on the call. I just wanted to say hello to her. And I know that the Borough President's Office has been having some conversations around the possibility of a roundtable or a convening of some sort that would include the leadership of the nonprofit sector and also other stakeholders to have a conversation about safe reopening. So I just wanted to recognize her presence on the call and hopefully have the opportunity to hear from her or from the other staff at another time about the possibility of that happening. Thank you.
Can we hear? Thank you so much. I think I've met you before, haven't I? Yeah. Can I just have a quick question or clarification? HIPAA, you are not allowed to ask, or it's not required that you answer whether you've been vaccinated or not. What about all the college kids?
Because of certain employment requirements for schools, you can't go to school without the vaccine. There's laws around that. But with regards to, you can ask a person, but we don't ask for vaccines. When somebody is hired to work for senior centers, it's not required like it is when you work at a school, when you work at a hospital, you have to show that you've been vaccinated. It is not the same requirements for senior centers. So when you're asking, there is not a mandate. That's the difference. There's no mandate on this point. Now, right now with the public schools, there is not a mandate yet. Obviously, come the fall for the colleges, there will be a mandate. They're not going to be able to mandate the kids yet for the elementary schools because they can't be vaccinated.
What about nursing homes? I won't tell you that our committee and our community board passed a resolution to say that you have to be vaccinated for COVID to work the front line, not the accountant in the back office, but the frontline people need to be vaccinated. All we could do is urge our elected officials to pass something, and that hasn't happened. I don't know if it's going to happen. I heard it may not, but I think that's important. I think it's not fair that something can't open or somebody will get sick or somebody, the whole senior center would have to be closed down if one person gets sick.
I just want to say something quickly too. I echo a lot of what Bonnie said, especially around the need to reopen. A lot of our senior center members have expressed exactly the same things: isolation, wanting to see people in person. Zoom really, it doesn't cut it. It really doesn't cut it. And I think that's felt across all generations. And I also want to point out, I can speak specifically to Taft, which is that some of our staff are actually seniors. And so they have their own personal concerns about being in a space. Our particular space is much smaller than Stanley Isaac's at 93rd Street. They have their own particular concerns about being in a space. And really for us, we took over the space a year ago. There's still a lot of renovations needed. Ventilation is an issue there. So it's a concern bidirectionally, right? There's a concern for staff safety because we want them to be able to perform and to be safe at work. And then we want it as well to be done properly for obviously all our seniors who, especially in East Harlem, we have a lot of seniors with a lot of different chronic ailments. Asthma is a huge issue in the area, so they would be greatly affected. So we're looking at it from that need as well and considering their feelings about being in a space. So just wanted to bring
we
that
have a question or comment from Ellen. Can we unmute Ellen?
Thank you.
Hi, I think the question was answered. I just wanted to know why an employer is not able to require that people have certain vaccines. I think you pretty much answered it. Since the senior centers are not private employers, you need to be mandated to do that, I guess. So is that correct? Is that the correct reason?
So from my understanding, and again, I'm not an expert in the legal sort of aspects of this, but what we have learned is that the law is a little uncertain at this point in terms of what a provider can or can't require in terms of mandating vaccination. We know that the colleges are pursuing this. We know that there are other entities that are beginning to sort of pursue this, but we at this point, we have no legal guidance, I would say, that makes it clear to us that mandating is required. But we are hoping to learn more as we go, I guess would be the best way to say it. As providers right now, we are, I think, universally in the not-for-profit sector, the human services sector, thinking about this literally every day about whether or not a mandate is ultimately the pathway to ensuring safety. But we can't make that move at this point because legally we're not sure whether or not it's going to be held against us. So again, it's just a very loose sort of question right now. And we've had multiple attorneys talk to us about this, both representing a variety of interests. And I think because it's a new issue and a complicated one, the answers haven't been crystal clear. The other piece to remember, by the way, is that for us, as providers, as Alini pointed out, there are concerns on the personnel side. There are concerns on the participant side. And we are well aware that there are older adults who have already communicated that they are very enthusiastic about coming back. It's caused them a great deal of pain to be away from the center, but have also expressed fear of coming back to a space where someone may be vaccinated and other people may not be vaccinated. So we're going to have to figure out how to navigate that as well. And those are going to be challenging conversations. I'm certain to have, we can certainly have, especially considering that not everyone can have a vaccine, because we know in some medical cases, folks can't be vaccinated. There are religious issues in some cases related to vaccinations as well. And there's also personal choice. So these are very complicated questions that I'll just be perfectly blunt and honest. We're getting a lot of different guidance from a lot of different places, and the law doesn't seem crystal clear. And I'm not capable of speaking on what rules the University of California is using or not using to mandate the presence of folks on their campus with vaccination.
But there's mandating, but there's also asking, so that you can say 90% of my people are vaccinated. You can't even, I know you could ask, but you can't demand an answer.
No.
No is the answer.
Oh,
no.
Okay. That's a surprise for me.
You can, because again, it's about medical, and it gets to very gray area. And if you push, you like Gregory said, you're opening yourself up potentially to lawsuits. And this is where it stemmed from the beginning. When it's, unfortunately, money drives everything. I'm going to be very frank. And we are in a very litigious society, and we have to protect, people have to protect themselves. And I think that's a lot of why there's a lot of fear around how do we open, how do we do it safely? And it's just easier to say we're not going to open. And then all of these questions, because the other thing to think about, and everyone talks about restaurants, it's not the same. And one of the reasons why we had to shut down so quickly the meal programs, when you go into a restaurant, you're sitting with another person that that's in your cohort. When you're sitting at a senior center, you're sitting with other. And that's where that, in a congregate setting, you're not necessarily sitting within your cohort. So it can be very different. And that's where how do you go about doing this in a safe way? And when the seniors come back, it's going to potentially look very different if we still have to follow the 6 feet guidelines and things like that.
Masks.
So masks, things like that. Yes.
I think there's obviously many issues here, but I think one thing is clear is that the city needs to have a plan of action and needs to have that plan now, because you won't be able to open overnight. I'm sure there'll be many rules and regulations, and you need the time to be able to implement those things, but also just by not having that plan or not even giving it the full attention it deserves right now, the city's further delaying something that we all feel is so essential.
I agree. That's what I was going to ask, because this came up at the borough president's meeting. Is there anybody else have their hands raised? I don't see it. Right? Am I right?
I would like to say something when you get finished.
Okay. Okay. Why don't you go? Because what I was going to say is, what do you want us to do? I think we'd be willing to pass a resolution. What is it that we should ask for? DFTA to work with you quickly, or But Wilma, do you want to answer something first?
Yes, I would like to. I would like to know if they're saying that the senior centers are supposed to open by July, and this is not working with everybody to open by July, and they say, oh, the senior centers are opening July 1st, and the senior centers are not ready. What happens then? They only have less than 2 months to prepare.
So
what's being done now? What's being done now with DFTA to help, other than giving a lot of different rules about things and confusing people?
We at Hamilton Madison House are starting to prepare. We are looking at CDC guidelines. We're at this point, I think agencies need to start moving forward and figuring out for themselves what needs to be done we're bringing our staff back. We were intentionally going to bring our staffs back sooner than we bring any seniors back, because it's still not really clear. They say you can open, but what does that exactly mean, and open for what? So I don't think you can wait for DFTA to give you guidance. I think that unfortunately if you wait for DIPTA to give you guidance, you're only going to hurt your program. You need to start looking at the rules, looking at the guidances. Schools are safe. Our early Head Start has been open since September. They've been able to figure it out, what you need to do and move forward and prepare yourselves and bring back people as you feel safe. I have another issue. On top of COVID, I'm in our organization, because I'm down in Lower Manhattan, I'm dealing with an anti-Asian hate issue and a violence issue. People are very fearful of getting on subways right now, and can you blame them? Every other day they're talking about attacks on the streets. So there's a lot of issues that are happening right now as we're starting to want to bring people back. So it's a lot of different factors that we're facing as we move into this new found situation.
If I may, I'm going to ask again. I'm sorry, you go, Rebecca.
We have Ellen has her hand up.
Oh, okay, Ellen.
Yeah, hi. Is there a concept of all the senior centers saying we're not going to open unless these requirements are met?
No.
And could there be? Could there be? could there be I'm so concerned. I'm so concerned about the vaccine, because vaccines are not 100% effective for seniors anyway, because people's immune systems are different. So, if other people are not, choosing to be vaccinated, and then you get somebody who has a moderate or minimal, had the vaccine and has some serious health issues and has had, not as robust a response to the vaccine as they might have, then they're more likely to catch something from someone who is unvaccinated. And so I'm still concerned about that. And all the other issues about restarting, can't the senior centers themselves gather together like a union of senior centers and say, look, this is what needs to happen in order for us to open? That we need some support here and some mandates, because we have a special population that has been hardest hit, and you've got to help us. We need to open. We need to open in this way, and you need to do this for us.
Yeah, if I could jump in on that, I'll just say, and I think this relates to Barbara's request for a resolution. I mean, I think the reality is, if we're able to say, perhaps there would be something valuable about saying, the need for centers to reopen is critical, given the complexity of the issue and given the complexity of COVID and what we're dealing with in terms of vaccinations. The reality is that the best we can do is try to come up with a set of standards, and that if the not-for-profit sector, the community-based organizations can have access to public health officials and be able to establish its own baseline set of standards for reopening, that it would be critical that the Department for the Aging be able to provide the resources to support that baseline, so that centers within the community board area can reopen. To your point about all centers deciding that they don't, they won't move forward without agreement, I would say that's a stretch, because I think given the way the different centers look and operate, it gets very hard to come up with a universal plan or agreement about action. But I do believe that the providers within this community board could be convened, could come together, could come to some conclusions with support about what it is that we need, what the baseline is for us to be able to operate, and for the community board to implore the city to give us what we need so we can meet those baseline standards to reopen. And July 1 was a date that has been thrown out, but there is no guidance around that date. There's no guarantee around that date. From my perspective, if we can establish the baseline and we have the resources, we can move more quickly than July 1. quite frankly. And that's what we'd like to do. I don't want to wait anymore. What I want to do is be able to have establishing a baseline.
Well, I think that's a
So
resolution.
I'll propose a resolution, since I think, Greg, you might not be able to vote. So, but obviously listening to what you said and adding on to that, obviously talking about the resolution can begin with talking about the need, but then focusing on that the city, has to act on this now and should be engaging with these centers as partners to figure out the rules and regulations and have that figured out ASAP so we can get our centers reopened.
And is DIFTA the only agency? Is there some other agency that we should be talking to? That you would be talking to, not we, but that we should be asking for guidance?
DOHMH needs to be involved. Health and hospitals should be involved, because that's where your test and trace core comes from. DOHMH is going to be responsible for maintaining I think the expectation related to public health.
Greg, you're right, because whenever the commissioner at DIFTA talks, she refers back to Department of Health.
Yeah.
Department of Health sets the policy and the guidelines that we follow. And that's the New York City Department of Health.
And we also need to include NYCHA, because many of our facilities
Absolutely.
are buildings. And NYCHA has held us to standards that DIFTA holds us to different standards, we have a bigger problem, right?
Oh, boy.
And before we continue, I guess, talking about the resolution, is there anyone who wants to second it?
Yes, I do.
Okay, Wilma seconds it.
Right. And then who from our community board? I guess, Greg, you can't vote, can you?
I can't vote.
For cause, everybody. You're not allowed to.
For cause. For cause.
Was it just Ellen? Who else from our committee is on?
We have Meryl.
Oh, Meryl's on. Great, Meryl. Thanks.
So it'll still pass.
Yeah. Is anybody voting?
Does anyone have any other comments or questions about?
I just want to know if if somebody from the borough president's office wants to say something, or I don't want to put anybody on the spot, but.
Hi, everybody. Isabel, working from the office, so if wearing
Isabel.
So basically, the board president has been working on senior issues for a long time, and so during the pandemic, she has remained focused on prior needs and new needs that have arisen, and we will continue to work on removing barriers. We still have some homebound seniors have had difficulties, for instance, especially in vaccination, and there's still many other barriers. And again, with the gradual reopening, thinking how the senior centers offer so many features for that population. And recently we had a rally type of, bringing attention to the city leadership about the needs of considering senior centers. And so what I can do is find the latest that we have, testimonials and letters to the mayor and governor, and share with the committee, with the board. I believe you have to.
You'll send it to Will, maybe, and you'll send it, or to me. Great.
Yeah.
Just tell me if this is out of line to add to the resolution to encourage the borough president to hold the round table so that there is some agreement amongst the stakeholders. It should be the stakeholders that sort of guide what they want to do, I think, or is this out of line? Please.
I know. I think when I initially proposed, I did say, they need to work with our centers as partners because, they know intimately what they need. Okay. I don't think we could call on the borough president to be the organizer of that. I'm not 100% sure. That might be like asking for something so specific, but I guarantee you Gail will be involved if that.
Well, it was brought up that she was having, yeah, Isabel?
Yeah, exactly. Thank you, Rebecca. Yeah, that's accurate. Yeah, so that we are more than happy to support, be it by being present, by sending a letter of support, and any. But yeah, like you said, probably not being spearheading, organizing this roundtable.
Okay, I thought that was said at the beginning.
Right.
But what we can do is we can reference the initial letter that Gail sent to us, that she sent to the governor and the mayor, urging them to take action if we want to acknowledge such an important role that she's played in getting these conversations going.
Well, you brought up an interesting point. Is this state or city that would make the final decision? Greg, Bonnie, anybody know?
I think it's probably both.
Is that Bonnie saying that?
No, that's not Bonnie saying that. It's okay. So the executive order was by the state, and a lot of times the state and the city don't always communicate as well as we would like them to. Notice that? So I would say that it's probably a lot. Sometimes the governor defers to the mayor. It may be both of them having to say this, but I will tell you, senior centers are open in other parts of the state.
So it means that he has already okayed it. It's the mayor that has the city.
It gets a little green because there are times where he'll say you can open in this location and that location, and then not in New York City. So I know that the big issue is the executive order, and he needs to lift the executive order because that's the state mandate. And it depends on where we're at with the executive order. And I think we need to check with our state officials to see where we are with lifting the executive order.
When we send a resolution, we send to all of our electeds, and would it be Dick Godfrey, the chair of health, and the head of health? That would be like, who would you send to?
Send it to the head of health and the head of aging.
Yeah, head of aging.
Why am I blanking on that right now? I'm so sorry. I'm blanking on her. I believe it's her. It's not the one in Binghamton anymore. It's
I just wrote a long resolution in support of all of those bills about nursing homes, and she was a sponsor on a lot of them.
I think from Syracuse or something, right? The one from Syracuse. I think she was from Syracuse. Whatever, we'll find it. That's not the issue. And
you could do both
on the council level, not only our immediate council, but we'll also do from the community board 11. We'll do others, but the chairs of the health and the aging. Who's aging in the city?
Margaret Chin.
Right.
And the last thing, and then I think someone could call to question to vote on this if they see fit. But I think one thing that might be interesting for us to try and do, I don't know, Will, maybe we could, after the full board, send the resolution, if it passes, to the other community boards, and maybe see if that would be a resolution they would want to pass as well.
Mm-hmm.
I think it's a good idea.
Mm-hmm.
The more people and more boards involved, the better.
Right.
Sorry, I'm so bad with names today.
Yeah, Pocky stepped in because Greg had to step out.
Okay.
Yeah, apologies for that. Just wanted to chime in really quickly. The one sort of, I guess, caveat to all of this is, yes, we absolutely want to call on, city government, elected officials, city agency leadership to put out guidance. I think from our perspective, the key here is that instead of blindly sort of putting out messages and guidance, we need to be in other words, our staff, and Bonnie's staff and the staff of the senior centers know how to safely reopen. We have the playbook. We want to be able to do this safely and smartly, right, and strategically. And so instead of just calling on sort of city government to tell us what to do, we need to be at the table to develop the appropriate playbook, right? And we actually should be the ones who are leading the conversation and not reacting to what's being put out and what's being required of us to do as contractors, because that's been the formula all along and it has not worked.
It's not working.
And the things that have worked throughout this pandemic is when the nonprofit sector has stepped up and stepped away from those messages and has done what is right for the communities that they serve. And so if there's going to be any message that goes to city government leadership, it really has to be about allowing the human services sector to do what it does best, which is lead.
I think that's the way we do the resolution.
I agree completely, and that's definitely what I was trying to stress.
And it's not only
when I proposed this.
Bonnie, you were on that Zoom call with the borough president. I remember her saying, "You're the ones that have to tell DFTA what you want." She said that what she found is that if they sit around and they don't know what to do, when you go and say, "I want to do ABC." Isabel, did you hear her say that too? Am I quoting her correctly?
That's what I heard. But the problem with that is that DFTA doesn't always listen.
Well, we'll phrase the resolution and to do it. I mean, we'll do our part as much.
No,
as
and I think that's what works best is a very concise, clear message that comes from the mass. And when it's clear and it comes from a large group, you have a much better chance of movement.
So the whereases is why it's so important to open it. The whereases will also say that they need guidance. The whereases will say the ones that know best how to open are the stakeholders, or the ones that run their senior centers. And the resolution would be that we ask DFTA, the ones that you mentioned, health and so on, to work with the stakeholders so that they can develop safe practices to open up.
Yeah, essentially it's kind of a three-part resolution: a brief thing explaining the importance, and then calling that we need our centers open as soon as possible, and that not only do we want the government to be working on rules and the regulations needed to allow our centers to open, but that we want them to be speaking with the people directly involved to make sure, because they know best, and to make sure this happens immediately. I see Ellen has her hand up again.
Yes, could you keep me unmuted, because I'm a committee member. I'd like to be.
No, we don't do that for committee members. It's just the chairs and the presenters.
Okay, so my suggestion is that we ask the senior centers what they want us to say.
That's what we're saying.
What are their criteria for reopening, and then we'll write that into our resolution.
No, because they'll never have it by next Wednesday. We have 6 days to get this done. No, they'll have to meet. This is going to be a big project.
We have
the criteria is not even done yet. They have to have a meeting with the stakeholders and figure out how they're going to do it. And then maybe they can, do the criteria of opening. And that's going to take a little bit of time.
Right.
But we got to do the resolution so something get started.
And Will, maybe if you could send the letter that Gail sent, I think it's pretty similar in terms of kind of what we're planning on asking for, so that if anyone wants to look at that.
Isabel, could you email it to me right now?
I want to add one more thing to the resolution, and please, Bonnie, all of you tell me if you agree, that also that the city should provide funding to help in preparation for the PPEs and other things. I don't know quite how to word it, but that I think we'll need funding. Am I right?
I don't know if the city, it's part of the state, I think. I think it's not just the city. It should be funding from the state
and the state,
the federal, and
the state trickles down into DFTA. DFTA is the area aging areas, the AAA for New York City. So they do get money from the state, and then it is given out to the programs within the city. But
so do you agree we should add that to the resolution?
I don't.
Well, Rebecca, can Bonnie please answer? She's the, Bonnie was answering.
Okay, the money is available, but it is a very arduous process to get the funds, because you have to do, if you want money for COVID expenses, it's a process. So it's not a simple process to obtain the funds because it's tied up with federal know-how. But like with the grab and go option that is currently being offered to senior centers, there are certain things we have to offer. PPE is one of them. You can put that down in your needs and you can request it. But like I said, everything is a process.
Okay, so don't put it in the resolution is what you're saying.
No, because they're going to come back and say that it is available.
Okay,
so
fine. Okay, Rebecca, I think you were agreeing with that. I just didn't know whether you wanted to.
Yeah, no, what I was going to say is, this, to me, I don't want to add anything that they could potentially disagree with. I would have been happy for a separate resolution, maybe calling for more funding, but I think the focus really needs to be on getting these places open. And maybe I can be too skeptical, but I don't want to ask for more.
Well, I wasn't saying it should be a separate one. I didn't know whether it was, it sounds like it isn't necessary for us to ask or appropriate, right thing. Are you sad? Is there anything else we can do to help this issue, Wilma?
We need to someone should call to question so we can at least vote on this. Okay, Wilma and Barbara seconds. Okay, so for just committee members or board members as well, if you would like to vote no, abstain, or not vote for cause, please raise your hand. Greg?
For cause.
Perfect. Seeing no others, the resolution passes 5-0 with one not voting for cause.
Should we announce the names just so that we have it on the record?
Sure, I have them in my notes, but Rebecca
I
Dangor,
actually think
Barbara,
Ellen is not here right now.
But she was here.
No, well, if we're voting, then she must have just dropped. She was here when I called the vote, when I called raise hands. But it's up to you, Will.
I mean, you can clarify with her afterwards just to make sure.
Yeah.
But yeah,
okay.
And she dropped.
So Rebecca Dangor, Barbara Rudder, Wilma Johnson, Meryl Brodsky. We'll double check with Ellen. 0 no, 0 abstentions, and 1 not voting for cause. Greg Morris.
Great. Thank you, everybody.
Okay, thank you.
So I'll see. I have a 6:30 Parks meeting. Will, I'll see you at 6:30. I thank you, everybody. I hope this works.
Bye.
Goodbye.
Bye, thank you.